Hi everyone, so welcome to another episode of Before and Beyond. Today I'm going to talk more about full mouth rehabilitation. And full mouth rehabilitation, essentially full mouth rehab or FMR or full mouth reconstruction, is a very, very vague term that means that there's a set of different types of treatment that is aimed to actually overhaul the bite, the aesthetics, the function of the patient. And the indications for it is actually quite complex and very, very multi-reaching. And so in our courses that we teach, we split them into simple, advanced, and complex. And in the most complex ones are usually having an issue with an unacceptable bite. So whether the bite is causing them to have discomfort, whether the bite is dysfunctional, whether it's constricted so that when you're biting down you feel like your jaw is getting pushed back, or whether the bite is just too many bites already that they actually don't know how to bite. These are all requiring some form of reconstruction. All right. And this reconstruction can come in the form of orthodontics, so that's braces or Invisalign. It could come from implants. It could come from dentures. It could come from crowns and bridges. So it's like all spanning. So it's very hard to just say one. And usually when I do a full mouth reconstruction, I'm working with a team of dentists or specialists that we then come up with a plan together and come up with a sequence of events to find out our angles, and then then execute it with the patient as well. So the patient is working with a team of experienced dentists or specialists that come together to be able to produce something that is acceptable for the patient in terms of function, aesthetics, bite, and also phonetics. So that means how they can speak well as well. So all these all come into one goal is to give all this back to the patient. And so these are all the indications that I usually give to my patients, to our students, and how we actually teach them about it as well. Now, this is one of our patients over here who came to our clinic because he was complaining of a lot of sensitivity, a lot of pain from the sensitivity. He was also complaining about a lack of aesthetics. So he really want to change his smile. He wants to reduce his sensitivity. He also wants to get a better bite. Okay, and I'll tell you why later on. So this is one of the things that we do. We actually take a face scan of the patients, and then we can see over here we have a superimposition of his teeth. We're using a scan with his face. Okay, so we get all his data there. So the idea behind all this data gathering, as you might have seen from our previous episodes, is to actually get as much data as we can on the patient so that we can plan as though the patient was in our clinic all the time. So we get all this data that we have, and we can plan how we can sequence the events that we need to achieve his goals. All right. So you can see in the mouth, it looks like that. So you can see there's a lot of things happening here. So let me just run through one by one about what we are looking at through a dentist's eyes. Okay, so you can see there's a lot of staining, first of all. So the surfaces of the teeth is rough, therefore it stains a lot more. He also chews betel nut, he's a foreigner. And so that one we have to talk to him about how to reduce the intake. He also has a lot of chips over here, and that's from fractures. And his teeth is overall a lot more yellower. And it's yellower because there's a lot of erosion happening here. Erosion means that there's a lot of acidic, there's a high acidic intake or high acidic environment in his mouth, causing the teeth to erode and wear away chemically to expose the inner part of the tooth, which is the dentine, which is often a lot more yellower. And these dentine have tubules in them that connects to the nerve, and therefore if you expose the dentine, you get a lot more sensitivity as well. This is a lot more apparent when you look at his overall health. You can see that over here, what you're looking at is multiple exposures everywhere, multiple exposures of the teeth, of the dentine. All right. So you can see the dentine is being exposed. Therefore, the tubes in them are being exposed. Therefore, whenever he drinks something cold or hot or anything that changes in temperature, it causes sensitivity and pain. All right. So you can see there's quite a significant everywhere. To be honest with you, everywhere is all really worn down, and this is caused by erosion. So that's what we talk about, chemical erosion. That means having a acidic intake, having an acidic environment in the mouth, and it's to do with grinding. Okay, so there's a lot of wear and tear happening. This is exponentially a lot more worse if you're having an acidic intake of foods, because that softens the tooth, and then as you grind your teeth, you're going to grind out the tooth itself. So we want something that is wear resistant, so that means it doesn't wear as fast and doesn't grind down as fast. Also, at the same time, it's a bit more resistant to any acidic intake of the teeth, of the body, or of the mouth. So you can see that what has happened is that because of the constant erosion of the tooth, the dimension, the vertical dimension of the tooth, from like that, the teeth was like that, we have sort of gone down and down and down and down and down. Okay, so his teeth, his overall face has reduced in dimension because the teeth has just worn down over time. Now, if I did a regular conventional crown on all the teeth, and that's what a lot of people do, what's going to happen is that we start to trim too much tooth away. So imagine if I did this and I trim his tooth down all the way, trim his tooth down all the way. If I did a regular crown, what can happen is that I will most likely expose the nerve, because the tooth is so short already. If you look on an X-ray, the tooth will look like this. Okay, and a natural tooth will look like this, where the nerve is over here. All right, so this is the nerve inside. Okay, maybe I can draw it in a different color. So the nerve will look pretty much like this in a natural, healthy tooth. But when you wear it down, all right, it becomes flat, right? Becomes flat, and it's nearer to the nerve, right? So if we do go and plan for a dental crown without increasing anything, we're gonna trim his tooth away, and you'll be extremely close to the nerve, and that might cause a lot of issues with a root canal and cause a lot of pain to the patient. All right, and so the worst case scenario would be we actually did crowns on the patient and we essentially kill off the nerve or damage a lot of the nerve, all right, or the root canal of the tooth. So if we can try to increase the vertical dimension of the patient. So the patient is not currently used to be biting like this. I'm just trying to see. Yep, used to be biting like this, but over time the teeth has worn down and the vertical dimension is this. We want to try to go back and regain that space again to go up like this. Okay, and how we do that is by increasing our vertical dimension. So when you increase the vertical dimension, we don't need to trim so much tooth away. We just build up material back up here again. Okay, so I'll explain to you very soon, but it's a bit of a hard concept to grasp. So just let me know if you have any questions. Happy to answer them as well. So you can see it's really worn down. What we first did was we then did a smile trowel. So this is a smile trowel, and essentially a smile trowel is that we put some material, we design his smile based on his face and his teeth, and we put this in the mouth. Okay, we put this in the mouth, and we'll take some photos. This gives us an indication of how we should put the teeth, where we should put the teeth, okay, for our final outcome. And so if we know the final outcome in mind, we can then build a series of treatment or procedures to build to the final outcome. So having the smile trial is important for us because it tells us how the teeth should be like after the whole entire treatment, and also tells the patient what he might look like after the whole entire treatment, most likely look like actually after the whole entire treatment is done. Okay, so this smile trial is essentially putting on a fake smile, fake material on top of the mouth, on top of the teeth, some artificial material on top of the teeth, to be able to visualize how the smile can look like after the whole entire procedure is like. Okay, so it's not permanent. This is taken out immediately after we take some photos. We show the patient, we take it out, but it creates a blueprint of how we should manage the whole entire procedure. Okay, so let me know if you need more info on this. I'll put on the comments below a video that we did about smile trial as well, so that you can actually learn more about it. Okay, so we have the blueprint in mind already. We then did scans, and this is how we design the smile trial. We base it on a digital scan that we do, and we put the face inside as well, and we design it so that the smile is harmonious with the face and harmonious with the teeth. And often, if you design something that's aesthetic, function usually follows, and function actually follows well. So as long as the aesthetics that we are designing looks natural, function always follows, and we can manage function there. Okay. Now, how we determine how the patient should bite. So think of the patient as having totally worn down teeth like this. So it's totally flat. The upper and lower are literally flat, right? And so if we just ask the patient to bite down, boom, right? Ask the patient to bite down. He doesn't know where to bite because it's just totally flat. It's nothing like a jigsaw puzzle that fits nicely. All right. And so for me to be able to redesign his whole entire vertical dimension again, is how long the teeth should be, I will need to have a reference point. And this reference point is created based on what we call a deprogrammer. So a deprogrammer essentially the patient puts on the deprogrammer, so it fits onto the roof of the mouth, and it has this platform over here. This platform makes the patient's lower teeth only bite on this particular spot. Okay. Now, when we take the teeth out of the equation, the muscles and the joints will reconfigure itself to a certain position, thereby deprogramming itself so that it reconfigures into a new position that the muscles and joints are happy at. Okay? And it's called centric relation, or CR, but in colloquial terms, I will just call it as the happy position. Okay? The happy position is a happy position that is reproducible, that is asymptomatic. That means the patient is happy with the position. The joints are happy, the muscles are happy, the patient is used to the bite. So that's the position that we are working towards too. So I put this deprogrammer in to the patient, and I get him to wear it for 2 weeks. 22 hours a day, only during meal times he's taking it out. But you put this on, and essentially what we're trying to do is we're trying to deprogram his brain, his muscles, his joints, to reconfigure the jaw into a certain position that is happy for the whole entire system. and we record the position down. And so how it looks like is we record this and we put this on top of what we call it articulator. So articulator is like a machine that simulates the position, simulates the teeth position, the upper and the lower arch in relation to the joints. Okay, so this is how it looks like. So you can see that his jaw has moved forward already when the patient is deprogrammed, and essentially it created a lot of space here. So you can see that the jaw has moved a lot more forward. Let me just draw it. The jaw has moved a lot more forward compared to in the past, where it was locked behind the upper teeth. And also at the same time, it has created a lot of spaces over here. Now, this is called the happy position, right? Or CR position, all right? This is called the happy position. And so I want to give this happy position to my patient because the patient is happy, right? With this position. And so how we do it in this case. Okay, you can see there's a large gap over here at the happy position, all right? Because we increase the vertical dimension already and the jaw move forward, right? And when that happens, that's a happy position. There's a lot of space over there. So we need to now have something in between the spaces to hold the bite. Okay, to hold the bite in that happy position. And now you can imagine that I can't just put one tooth alone. I can't just put one tooth here. Okay? Because if I just put one over here and I put one here, I can't, because the patient is only going to bite on one tooth. So in a full mouth rehabilitation, it usually means that I got to do multiple teeth. To be able to make the patient bite simultaneously on all teeth in that happy position. I cannot just do one. Okay, I need to do a lot. Therefore, usually for a full mouth rehab, it usually costs a lot because we have to do multiple teeth. All right. If in this situation we are looking at doing upper and lower teeth, because if I did just upper only, if I just did upper only, the tooth itself is going to be extremely long compared to the lower teeth, right? And so it's not aesthetic. It's functional, but it's not aesthetic. And the tooth is gonna be extremely long, and there's mechanical issues with it. So in this case, I would have to do upper and lower to redistribute the space. So I need to do upper and lower in this case. But if the vertical dimension is not so much, and the teeth are in a good position already, I might just need to do one arch. Could be the upper or the lower arch, depending on a number of factors. Okay, so with full mouth rehabilitation, our goal is to try to minimize the cost, but give you the same result, and minimize the biological damage to the tooth to give you the result as well. So if I could try to give you just a single arch to give you a good bite and good aesthetics, what I did for him is that in this case, we actually did no preparation. That means no trimming at all. Onlays for this patient. So essentially, the gaps over here, I essentially fill up with ceramic onlays for him to hold the bite, and I do it for both sides. So you can see on the upper, I did 1, 2, 3, 1, 2, 3. So my plan for him was to build up the back bite first, to hold the bite in that certain vertical dimension and in that happy position. Okay, and then once we are done with it already, then we move on to the front and we do the lower and the upper after that. So it's a very systemized approach. So we did the upper first and the lowers together. This is the lowers. So the uppers and lowers are holding the bite in a happy position, just like this. Okay. So in the mouth, how it looks like, and so how how it looks like if you're not doing any preparation at all is it looks like a taco, right? So you can see that imagine that the tooth is like that. This is on the upper tooth, right? So the upper tooth is like that, and the tooth is being glued on like an L shape. And this part here, this part over here is facing the front. Is facing the front, so it looks good. Okay. This part over here is facing the biting surface to hold the bite, right? So how it looks like is like that. So you can see. So we do here. By the way, this blue color thing is called a rubber dam. Is to make sure that when we glue on these onlays, it's by chemical adhesion. So it's gluing on using chemical adhesion, and we try to limit as much contamination as possible so that we can get the best outcome, right? So over here, what you're trying to do is we are gluing on an onlay, and the onlay is going to go on the front surface here and just rest on top. This is without trimming any teeth at all. All right, so here we go. And then we do this on multiple teeth. So I can show you how it looks like on this tooth. So it's going to go on top here. It's going to go here. Essentially. Okay, so this is going to be filled up with ceramic material. And if you do it on multiple teeth, this is how it looks like. We isolate the area, keep it clean, okay? And then we then try them on. This is try on, it's not glue on yet. But essentially to show you that if we put this on to multiple teeth, what happens is that we are able to hold that bite in that certain position, okay? And this is how we clean up the area. So we clean up the area already, and then we can try them on and we can then glue them on together, okay? And so if we did that on multiple teeth, you end up with this, right? So imagine in the mouth, now after I glue on the back teeth, I would have, when you bite down, the vertical dimension has been opened up. There will be a space in the upper and lower teeth because we just propped up the bite essentially. And so this is just to show you how much we are opening up. So this veneer is going on top of the old model, and we're increasing the height of the teeth, right? So you can see over here that this essentially is how much we are increasing by. Okay, we are increasing this. This is about 1 mil or so, and so we are increasing the bite from here, so that it becomes, so that we don't trim the tooth. Essentially, when you increase the bite, we gain volume just from thin air, and therefore we don't trim the tooth out, or we just have minimal shavings on that tooth as well. Okay, so this is how it looks like. And then once we do the back teeth, we do the lowest, glue them on already, and we are just essentially filling up the gaps, right? And so once we are done with the lowers already, then we did the uppers as well. So this is the uppers, we glue them on, and we're done. So this comes in stages. So we did up, lowers, the back teeth to pop out the bite. That makes the front teeth already present. with a space, and then we glue on the the uh, the lowest, and then we glue on the top. Okay, then from there we then finalize the bite already, and we got lucky because this was very similar to his mouth trial, and the patient was really happy about it, and it is our emphasis that we try to follow the smile trial as much as possible to get as realistic as possible outcomes. Now, now you're gonna ask me like, hey, if my teeth is very messy, how and really crowded, can I still do this? Can I still do a full mouth reconstruction? The answer is that in these kind of cases, I tend to want to do some pre-orthodontic treatment. So maybe some form of teeth straightening to be able to get the teeth in a better position before putting those crowns or veneers on. Okay. So what I'm going to say is that a full mouth reconstruction is an extremely complex treatment, and specialists such as a prosthodontist can provide you with this kind of treatment, or any experienced dentist. So it's such a broad topic that it's very important for you to get to see a good dentist and to get good data collection from your whole entire mouth, x-rays, scans, your bite records, so that we can actually plan the case together. Okay, and with that, I would like to end our episode today. Thank you so much again. Just let us know if you have any questions, and we'll be happy to answer them. Thank you.